Good morning. I'd like to call the Committee on Health and Human Services to order. It's Tuesday, February 28th, 2023, and we have a quorum present. Today, we will first take up Senate File 73, which we were working on last week, and Senator Port is here again to resume discussion of the bill. So I think we were at the point of questions and amendments, and I don't know, Senator Port, did you have any further comments or you want to make as we get started today?
No, just thank you for taking the time to have the full discussion on this. I appreciate it. I think we are waiting for a couple of amendments from me that are being printed and coming down.
Okay.
But we can go back to the conversations we were having before.
All right. Apparently, we have the amendments here, so those are available. Do you want to start with those?
Or Senator Abler had an amendment on the...
Okay. Do you have copies?
I do not.
Okay. When you have copies, then please, if you could let me know which one you would like to offer first.
Sure, thank you. Madam Chair?
Senator Port?
If we could move the A71 first, please.
Senator Mann moves the A71 amendment. It'll be passed out. Senator Port, do you want to describe your amendment?
Thank you, Chair Wickland. This is a very simple amendment. Last week when we met, we added recovery to the portion of the bill, to a portion of the bill in prevention, treatment, and recovery. Recovery was missed on one line, so this just adds in the recovery portion that was missed on that line.
Members, any questions about the A71 amendment? Okay, seeing no questions, all those in favor of the A71 amendment, please signify by saying aye. Aye. Any opposed? The motion does prevail. The amendment is adopted. Senator Port, do you have another amendment?
Yes, if we can move the A73.
Senator Mann, would you move the A73, please?
So moved.
And the amendment will be passed out, the A73. Thank you. Senator Port, do you wish to can you describe the amendment, please?
I can, yes. Thank you, Madam Chair. This is an amendment that we have been working on with NAMI to address a number of the concerns that they have in this bill. So it does a couple of things. First, it collects data from state courts and hospitals on the utilization of mental health and substance use disorders, emergency room visits, and things like that. So we're actually gathering the information to learn about the increase of visits and the services that are required, and obtains a summary so that we are making sure we're collecting that data to find out if there are increases in Minnesota. It also adds child welfare workers to a portion of the bill that is, let's see, line 21. Actually, I'll skip over that one for a moment while we pull that up. Requires that cannabis flower and cannabinoid products must be inaccessible to children and stored away from food products. Warning labels like that. Inserts the Commissioner of Human Services to develop the programs that are under treatment rather than the Commissioner of Health. And that we adopt evidence-based, culturally informed, and responsive treatments and services, that funds are used to promote the expansion of peer and recovery specialists, which is a particular piece we want to talk about. That is the most effective way that we have found in all of the research in the other states. Sort of peer-to-peer education is the most effective, both in preventing first use and also through recovery. The more support you have from your peer network and the more you're able to get accurate information from your peer network, the more useful it is, the more it sticks and it actually curbs behavior. So that is a piece that we wanted to build out in this. The final sort of big thing that this does is it deletes the Substance Use Advisory Council that's created in this bill and instead points back to the Substance Use and Opioid Council that the governor already has. We discussed that a bit last week, and in talking with DHS, with the governor's office, and with treatment and recovery experts, they say this would be a duplicative council, and that council actually is already doing the work across the state, and they would rather have it just point directly to that council.
Thank you. Members, any questions about this amendment? Seeing no questions, on the A73 amendment, all those in favor, please signify by saying aye. Aye. Any opposed? The motion is adopted. The motion does pass, and the amendment is adopted.
And the final one I'll be offering, Madam Chair, is the A72.
Senator Mann, would you offer the A72, please?
So moved.
And the A72 will be passed out. Thank you. Senator Port, do you want to describe the A72, please?
Yes, this adds into the sort of list of warnings that need to be developed by the office. A particular warning label regarding the effects of use of cannabis flower and cannabinoid products for persons 25 years of age or younger. This is a portion we've talked about that throughout testimony here, and there are several places in the bill where we have peer-to-peer education, where we have public service education and things like that, but we are also adding a warning label.
Members, any questions or comments on the amendment? Seeing no questions, on the A72 amendment, all those in favor, please signify by saying aye. Aye. Any opposed? The motion does pass and the amendment is adopted. Any further amendments?
That's what I'm, have to move. Thank you.
Okay. Moving to member amendments, are there any further amendments? Senator Abler.
Well, thanks, Madam Chair, and I don't know if you have a new copy available, but I don't even remember the number, what it was, but it's the one to change the age from 21 to 25.
I'm seeing that council has the amendment. I don't know, do you have, or you don't?
Madam Chair, it was the A63.
Okay, I'll move the A63,
Okay.
and I don't know if we need a copy. It just, everywhere it says 21, it makes it 25. There's about a dozen citations, I think. All the rest of the bill stays the same.
I'm sorry, I couldn't hear the last thing you said.
Oh, and it doesn't change anything else in the bill. It just changes the age, and I'm happy to, so I'll move it and then I'll offer a comment and we can discuss it.
Senator Abler moves the A63 amendment. Senator Port, do you have any comments?
Thank you, Madam Chair. Again, I ask members to vote no on this. As sort of a country, we have agreed that at the age of 21, you are adults. And we are providing ample education, specifically the kinds of education in this bill that we have found through studies in other states have been effective to actually get that information to young people about the dangers. But at some point, they're adults, and we have to trust that they will take the information and use it to make the best decisions for themselves. Also, I would add that alcohol has adverse effects on the brain. No one is calling to move the legal age of drinking to 25. Brain development, beyond brain development, both alcohol and tobacco have significantly stronger health concerns, and we are not sort of singling them out in that way. My biggest argument is that this bill is built on the premise that prohibition has not worked. It is a failed system that has not kept cannabis out of the hands of our communities, and our communities have paid a very high cost for that. If our goal is really to have people from the age of 21 to 25 not use cannabis, why would we focus on a failed prohibition system that has not been effective at doing that so far? Instead, we should focus on the things that we know that work, which is peer-to-peer education, which is getting public service education out there, which is, working through those systems that we know can be effective. If we were to raise the age of 25, we would be essentially shining a spotlight on young people for the illicit market to target them. And our goal in this bill is to work and use the best practices that we have across other states to stamp out the illicit market. This would be sort of shining a spotlight to them to target our young people. And so for that reason, I ask for a no vote.
Members, any further discussion or comments about the amendment? Senator Abler.
Well, I'm not going to belabor, we discussed this a little bit before, but I agree that you want to protect the young people from the illicit market, but I also don't agree that we need to neglect every scientific opinion about the harm of this particular product. Even in your last amendment, there's a warning label about under age 25. When it's age 21 with a warning label, the kids are gonna blow this warning label up and hang it on their wall in their dorm room because it's gonna be funny, because it's no big deal. We heard the good Governor Ventura saying if you're able to be in the military, you should be able to smoke a joint, because it's just that casual, no big deal. And so I talked with some drug people this morning. The growth in drug treatment these days, the fast growth is in marijuana. In the current circumstances, when we make it legal, there will be more. In your second amendment, you talked about more treatment. You talked about first episode of psychosis. You talked about emergency room visits. You talked about mental health programs, and they're going to increase. They increase everywhere this goes. And so the oath that everybody in the industry who does healthcare, you try to avoid doing harm. And one, it's above all, do no harm. I took a similar oath. We have a duty to people to not send them down a course. The Minnesota Medical Association agrees it should be 25. And so you want to put a warning label on this. You say, you can't get it till you're 25. I don't care if we criminalize it under 25, but if you, like we have a smoking thing where you can buy cigarettes when you're 21, but you can smoke them when you're 18. That's goofy. But actually, somebody thought it made sense, and maybe it's helping reduce smoking. And so I don't know where the votes are, but I can tell you, passing this bill with 21 will harm people. Passing this bill with 21 will make more cases of the mom who sat there about her son with psychosis who was age 22, who tragically killed himself. Passing this bill at age 21 will cause harm. And I can't remember a time in this body where we passed a bill that we know will cause harm. And that's why I urge members to vote for 25. Put a big star on there. It's not my goal to derail the bill, but it's my goal to make the bill that we pass be one that actually you can have some confidence that people that follow the law will actually not come to harm. So that's all I got, Madam Chair. Thank you.
Thank you. Thank you. Senator Mann?
Thank you, Madam Chair. So this is something that I've been struggling with quite a bit, as you know, and so I was leaning towards this entire time voting for the age increase. However, last night I spoke to several people, including law enforcement, fellow physicians, people from Colorado. I made a whole night of it. It was wonderful. And a couple things stood out in my mind. One is this notion that we as a society have decided that 21 makes you an adult. I don't know if I agree necessarily. I remember being 21 and being a complete idiot, but that's what we have decided collectively. And I don't think that people should smoke marijuana at that young age, right? I don't think people should drink alcohol at 21. But again, we have decided that we're going to allow people to make their own choices at 21. The other thing is that that was brought to my attention, I guess, is that if we take that group of people and we say that you cannot do this, they're already doing it, right? 21-year-olds, 20 to 25, they're already using, if they're going to use marijuana, they're already using marijuana. And in the states that have legalized it, the use for that age group, 21 to 25, did not increase. And that stuck out to me quite a bit. Instead, what happened in that age group was that they're able to get a legal product that is regulated instead of getting fentanyl-laced products on the street. And so, while it's still very difficult for me because, I work in the ER, I have a very skewed vision of what happens when there is alcohol use and drug use. I completely understand the other side, and I think that if we want to do our best to not alienate people, to not put fire under an illegal market, to make sure people are getting a safer product, then I think voting for keeping it at 21 is the right thing to do.
Thank you, Senator Mann. Any other comments or questions? Then we will move to a vote. And on the A63 amendment offered by Senator Abler, all those in favor, please signify by saying aye. Aye. All those opposed, say no. No. The motion does not prevail. The amendment is not adopted.
Thank you, Madam Chair. I appreciate the discussion, and I appreciate that this is still an important topic, but thank you very much.
Thank you, Senator Abler. Are there any other amendments that members have? Senator Liskey?
So I know Senator Hoffman was talking about carrying this, but I also offered to carry it if he wasn't here. So I move the A70 amendment.
Senator Liskey moves the A70 amendment. That will be passed out. Senator Liskey, can you describe the amendment while we're looking at it?
I'll do the best I can. So the amendment basically describes that a study will be done on the reservations in order to see if there's any increases in use or things of that nature. So I believe that's the basics of what this amendment is going to try and do.
Senator Port, do you have any reaction or response?
Thank you, Madam Chair. Senator Liskey, I'm wondering has there been conversations with the tribes on this? I've been speaking with them quite a lot and have not had a conversation about this piece.
Madam Chair.
Senator Liskey?
Thank you, Madam Chair. Yes, as far as I know, they have. Senator Green was in conversation with the tribes, and he had offered this as a possible amendment for this committee. And so since he's not sitting on it, he asked myself and Senator Hoffman to kind of look into what the possibility of carrying these forward, just so that we can have that information readily available.
Senator Port?
Thank you, Madam Chair. At this point, I would ask for a no vote on this. I'm not sure that this is the place to do research on the number of murders and death rates, especially considering in my many conversations with the tribes, I've not heard this at all. So I would ask for a no vote.
Senator Abler?
Thanks, Madam Chair. Senator Port, is this bill going to the Human Services Committee next?
It is.
All right. Well, Madam Chair, I just have a suggestion that, you know, none of us have seen this, and I don't know if it's a good amendment or not, and certainly, how could Senator Hoffman not have a good amendment?
Right.
That just seems to be impossible to me. But since we're going to go to the committee chairs, and this would give, now that the amendment is out there, it seems like a benefit will have been served. There it is, and then people can react. And so maybe you want to just consider waiting on it. So that's all I got.
Thank you. Senator Liskey?
Madam Chair, I will remove the amendment for now, and we'll let it have consideration in the next committee.
Okay, thank you. Senator Liskey withdraws the A70 amendment, and I think that would be good to have the discussion with those that are involved and Senator Port and really discuss whether these statistics, capturing these statistics would really be something that would be meaningful and of interest. So, any other amendments? Members, do you have any final comments or discussion before we go to the author? Senator Udke?
Thank you, Madam Chair. And I've got a number of questions that I would like to go through with the author to get some additional information. And I'm going to just take them as I've got them tabbed and roll forward. Under the definitions, and these things are going to come up in various points throughout the bill, but it just happens to be the way I've got them. But you've got bona fide labor organization, and you highlight that. Why? It appears that you are specifically saying that all employees are members of a organized labor unit. Is that correct, and why?
That is correct,
Senator
yes.
Port?
Thank you, Madam Chair, sorry. And Senator Utke, yes, as we're setting up this new industry, we want to ensure that it has good paying, good benefit jobs for Minnesotans. And so a portion of this bill, which will be discussed in length in the Labor Committee on Thursday, I believe, does require a labor peace agreement.
Senator Udke?
Thank you, Madam Chair. And I guess my only comment there, and I'll follow to see what we see come out of the Jobs Committee, or is it the Labor Committee you said?
Yeah.
But the fact that they're an organized labor unit does not, you mentioned good pay and benefits, that doesn't signify that that is the case. I mean, it could be the other way too. So I'll wait to see what additional comes out. I just happen to see it a little differently there. On page 6, the Division of Social Equity promotes development, stability, and safety in communities that have experienced a disproportionate negative impact from cannabis prohibition and usage. And I know that's going to come up here later again too in the bill, but why would not having legalized cannabis be a problem? I mean, I don't see where we're targeting and saying we've got communities that are suffering because they don't have that. We're going to see as we go even further into the bill, the fact that it's acknowledging the fact we're going to need more SUD services. We're going to need more, we're going to have challenges with the young people. We're going to have all these problems. Just trying to understand why that is a problem, not having it.
Senator Port.
Thank you, Madam Chair and Senator Uckey. What this really is getting at is that across the country, and true in Minnesota, is that people of color and white people use cannabis at roughly the same rate, nearly identical rates. Yet they are prosecuted at significantly different rates, over 4 to 1, that Black people are prosecuted for having cannabis, for using cannabis at a much, much higher rate than white people. And what this gets at is that there has been a discriminatory cost to cannabis prohibition that has affected certain communities more than others. And so what this is trying to get at is if you are a part of a community that has been targeted and really paid a much higher cost than any other community, that we want to ensure that as cannabis is no longer prohibited and as a legal market is setting up, and I'm sure you'll get to this in your questions, that you have a stake, you have the ability to get into this industry that has caused such drastic harm through our community, through particularly Black Minnesotans communities.
Senator Edke.
Thank you, Madam Chair. And I think, yeah, the answer kind of got away from what this little section was talking about. This is just talking about they didn't have, you know, it wasn't available. We're going into the legal side, more of the arrests and such. I don't see a connection there, but anyhow, the next one I saw that was something that concerned, and I would look for a little more information on, is on page 8, the labor peace agreement, and it goes on to talk about it protects the state's interests. And why would that be the case? Basically, from what I'm seeing, is the organized labor employee group that would be working there is not allowed to picket or have a work stoppage, et cetera, around this cannabis business. But why does that protect the state's interest?
Senator Port, or?
Yes, Madam Chair, can I introduce my expert as well and have her take this one?
Yes, please state your name for the record and you can answer the question.
Thank you, Madam Chair and members. My name is Layli Fadahi. I'm the campaign director for MN is Ready, and we have been working for several years, and especially over the last few months, to really do much of the policy research and stakeholder engagement towards making improvements to this bill. Madam Chair, Senator Radke, the labor peace agreement provision, it doesn't require that the entirety of the workforce in the cannabis industry be unionized, but it requires labor peace agreements because since one of the major public policy goals of this bill is to eliminate the illicit market and to ensure that there is adequate supply of well-regulated product that is safe and available to consumers. The concern from a state interest perspective with having a labor issue that interferes with supply is that would then push consumers to purchasing their products from an illicit market where they are less safe and unregulated. Labor peace agreements are not uncommon in situations like that where there's issues of health and safety of public interest that might be disrupted or compromised because of a labor dispute.
Senator Radke.
Thank you, Madam Chair. And I guess just a little bit of a comment. The fact that this would, well, it was brought up, so I'll comment on it, that the illicit market's going to go away. That is, from everything I've see, hear, read, et cetera, over the last number of years, it doesn't happen. That's a pipe dream. And in some cases, it grows because now we expose young people to the product, maybe through a legal purchase, but it leads to the illicit market. So, you know, I don't see that as, again, anything that pertains to controlling or reducing. It seems like this is only going to expand the use of this product. I get up to page 15, and you've got a medical cannabis program. It talks about the duties of the Department of Health. This is all being moved, particularly the medical cannabis, from the Department of Health to this new office. But how is that relationship between the Department of Health and this new office, how do you see that working? I mean, particularly the medical cannabis is still a so-called health product. They're going to have to work together. Where do you see that? How do you see that working?
Senator Port.
Thank you, Madam Chair and Senator Radke. There are multiple provisions in this bill, particularly as it gets to the medical cannabis program pieces, where they work in tandem with each other. They will work together. However, putting it all under one for the licensing, for regulations, for testing, for all of those pieces makes more sense than leaving that sort of off to the side under the Department of Health. We do have folks from DHS here today. If you have additional questions on that you'd like to ask them.
Senator Radke, do you have?
Yeah,
Department of
Madam
Health
Chair,
is
I
here.
think we should. I mean, this is the Health Committee, and I think it's important to hear that.
Department of Health is here, and welcome to the committee, and please state your name for the record.
Thank you. Good morning. My name is Chris Thokus, and I'm the director of the Medical Cannabis Program at the Minnesota Department of Health. Thank you, Madam Chair.
Senator Radke, do you want to phrase your question to, or further?
Sure. Thank you, Madam Chair. My question was, we see everything moving. I mean, it's establishing on the recreational side a new office for the cannabis, but it's also bringing along the medical cannabis, which would have a direct relationship as far as it's part of health care, and it's being moved over. How do you see, you know, my question was about the working relationship, because it's still prescribed as a health product, the relationship between the new office and the current Department of Health. Will you still be involved, or how do you see that, or what do you, I mean, it's all kind of proposed, it's still on paper, but how do you read it?
I'm sorry, your last name again was
Focus.
Focus. Ms. Focus.
Madam Chair, Senator Udke, the bill maintains the medical program, the definitions of medical cannabis products. It maintains the structure of the Office of Medical Cannabis as it operates today. It does create new license categories for the manufacturers, but largely the office will maintain the way that it operates today. The way that we operate as an agency right now is we do have very strong relationships with other agencies. For example, the medical cannabis program has a very strong relationship with the Minnesota Department of Agriculture right now, and we look to them for their expertise on cultivation and pesticide use and other things that are a little bit out of the wheelhouse of the Minnesota Department of Health. And I would imagine that a similar relationships with other agencies as needed would be what happens with the Office of Cannabis Management, that they would tap into other areas of expertise through interagency agreements or informal conversations for subject matter experts as needed.
Senator Radke?
Thank you, Madam Chair, and thank you. That's what I was looking for. So, Madam Chair, if I could, there's another, actually right in that same area. We talk about making loans and grants for these programs. What type of money or amounts do you see as being used in loans and grants? Because to me, and I'll throw it out there so you can respond to it, to let us know what these loans and grants will end up doing. But to me, it's you know, it's bringing a cannabis dispensary to a neighborhood near you. What is the idea behind this, and how big will it be?
Senator Port?
Thank you, Madam Chair and Senator Utke. There are not fiscal numbers in this bill yet. We're still waiting for the fiscal notes, and those will be added. But what I can tell you about the programs is that these are essentially to help people get into a brand new industry. We're going to need to set up a rather robust industry. We don't want it to be one or two sort of huge conglomerates who have the whole market. So our goal with setting up these programs, both for growers, to give business expertise, to open whichever level of licensing you have, to do education around that. The idea is to help people, and there is a social equity component to this as well, from communities who have been harmed and people who want to get into this industry, to be able to enter as smaller Minnesota-based businesses. What we were really trying to avoid here is having one or two of the big guys from out of state come in and own the whole market. We really want to give an opportunity for Minnesotans to run this market in small businesses in ways that can grow, but do not rely on one or two very large stakeholders.
Senator Radke?
Thank you, Madam Chair. And one of my questions later on, because that's at the end of the bill, was going to be, what have we heard about a fiscal note? I mean, we're 9 weeks into the session. You definitely had this bill available prior to session. Do we have any idea when we're going to see these numbers?
It's an
Senator Port?
Thank you, Madam Chair and Senator Aki. I do not. I know we got another portion of it was filled out, but we are still waiting on the full fiscal note.
Senator Radke?
Thank you, Madam Chair. And, you know, interested, I just see things I've highlighted as far as some of these studies that are required, driving impaired and such. I don't think we need to spend a whole lot of time and effort on these studies. The information's already there. As an example, I know in my home county, this was probably a couple months ago now at least, they were talking about how the jail, we no longer house inmates from other counties because we've got the jail full all on our own, and we've got a newer, what should be a large jail that's way more than we need in Hubbard County, but it's pretty much at capacity, and they said 85% of those people in jail were because of driving under the influence of drugs. And that's why, you know, as I go through this whole thing, it's so concerning is we're already tapping out our jails, our public safety things. I mean, they're at capacity, and we're going to add more to their workload. But anyhow, you know, I chuckle at the fact that we got to replace all our drug dogs. I mean, all of these things are kind of crazy. The fact that we're going to look to change all this. I got a couple more here that I'll. We had talked, and it was even part of the amendments, these, the labels that are going to be on these products. Do we think people will actually, that'll make a difference? I mean, we see it already in our current substances. They're more after, I guess if you want to call it, their enjoyment or their fun or whatever. They're not going to be concerned about if it says a certain thing or not. But school programs, I've jumped ahead. I'm on page 185. And it talks about the schools starting in 2026, 2027, that they need to start. They must implement a comprehensive education program on cannabis use and substance use for students in middle and school and high school. It, once again, showing how bad this is, but the big thing is it's a mandate to the schools. It's one more thing that's on their plate. They're trying to educate our students, and now, you know, how big a deal do you envision that? What is this something that they just have put out some flyers and talk about it once or twice during a year? Or do you think this is more part of a class that's going to take more emphasis to drive home what this product will do and the effect it could have on young people?
Senator Port.
Thank you, Madam Chair and Senator Uckey. As is on 185.2, it lays out that the Commissioner of Education must put together a model program. So I'm not a teacher. I am not an expert in that area, and we do have experts, and that's why we refer to them in this bill to help put together that program. I shouldn't be the one who's sort of writing that program because I'm not an expert in education. And that's why we defer in this bill to the department to help put together a model program that school districts can then use.
Senator Radke.
Thank you, Madam Chair. And now I'm back to, I guess it would be the end of Article 6. There's a repealer with about 3/4 of a page of stuff that's repealed. Can you highlight what's included in there without having to go through all of those? What are we taking out of statute, or probably changing statute, but could you give us a brief overview of what's all repealed?
Perhaps council could go through some of the repealers.
So, Senator Radke, are you speaking of page
Well,
213?
Yeah, I'm on page 213 and 214, but I was just kind of looking for a high level, but we don't need to, unless council's got a quick and easy answer, we don't need to go there at this time.
Madam Chair, Senator Uckey, I believe the repealer is repealing all of the current medical cannabis
Okay.
language, and then it will be re-put into statute.
Senator Radke.
Thank you, Madam Chair, and thank you for that. And that kind of was what I was anticipating, but that answers that. So with that, thank you, Madam Chair. I got through what I was kind of targeting or wanting to get more information on.
Any other members with questions? No? Any other members who have comments about the bill or at this point? No? You're all quiet? Senator Port, do you have some closing thoughts for us?
I want to thank the committee for its time and engaging on the issue. I think, I want to state for the record that, those of us who are working on this bill do take it seriously. This is not something we are flippantly moving without thought. This is something we're taking very seriously. And we're taking it seriously because it has done significant harm to our communities. The prohibition of cannabis has done significant harm to our communities. And we see it as critical that we do what we can to undo that harm. Is this bill perfect? No. It's 300 pages now. It's going to continue to have changes as we move through the process, and I think that that is good for the bill. I think it's good that we have these conversations. I think it's good that we continue to talk and ask questions and learn from each other, because our goal is to make this the best bill. I do think we have things in this bill that are taking the best parts of what have worked in other states to get at some of the concerns, particularly on the illicit market. We have seen major drops in some states. Montana, for one, went from about 80, after they legalized, 100% of the use pre-legalization was through the illicit market. Now over 80% of it is through the regulated market. That's a massive drop. And part of the reason that that worked is because they didn't have areas of the state that could continue prohibition. So there weren't blocks of counties and areas where cannabis was still prohibited, which killed out much of the illicit market. So we're trying to take lessons from those states. We're learning from what has worked in other states to curb use among young people, to stop that initial first use, which is peer-to-peer education, far outshines everything else above and beyond. And so, I really do appreciate the engagement, and I am happy to continue to work with folks as this continues through its process. I think it's about halfway through its committee steps now. And so we still have a long way to go, and my door is always open to continue these conversations, and I thank the committee for its engagement.
Thank you, Senator Port. And yes, I appreciate all the work that you've put into taking in feedback as you go along and taking steps to act on the feedback. And I hope that will continue. From my standpoint in this committee, I appreciate that there are a lot of proactive efforts planned regarding education of youth and education of adults on the health impacts, and that we can learn from other states, what has been particularly helpful in these areas, and that we can keep continuously improving the program so that we are taking note of any areas where we're seeing negative impacts, and we're trying to address them through means and education and programs that we develop. So I appreciate the discussion in this committee, and appreciate members your full discussion of the bill. Senator Mann, would you please make the motion?
Yes, Madam Chair, I move that Senate File 73 be recommended to, as amended, be recommended to pass and be re-referred to Human Services.
On Senator Mann's motion, all those in favor, please signify by saying aye. Aye. All opposed? No. The motion does prevail. The Senate File 73 as amended does pass and will be referred to the Committee on Human Services.
Thank you, Madam Chair.
Thank you. And now, members, we will move to the other 7 bills that we have on the schedule for today. The first bill that we have Coming up now is Senate File 1814, which is a Senator Fate bill, and Senator Mann is presenting for Senator Fate.
Thank you, Madam Chair.
And Senator Mann, please.
Senate
go ahead and
File
proceed.
1814 appropriates $500,000 in one-time funding for the Department of Health to develop a public health campaign on Alzheimer's disease and other forms of dementia. Currently, Alzheimer's is the most common form of dementia and accounts for 60 to 80% of dementia cases. Dementia will worsen with time, and there is currently no cure. However, we can slow its progression and improve patients' quality of life if it is diagnosed early. An important part of this bill is that the Department of Health must develop culturally relevant messaging tailored to underserved communities, including rural populations, Native and Indigenous communities, and communities of color. The reason for that is, for example, Black people are twice as likely to have dementia. Latinos are 1.5 times as likely. These racial disparities are driven by social determinants of health and not by genetic factors. Facing these racial disparities, the need for culturally relevant messaging on aging is more important than ever. Early detection has shown improved quality of life by empowering people with Alzheimer's disease or another dementia to connect with loved ones and meaningfully participate in treatment planning. It gives people time to take proactive steps to slow the progression of disease, and it saves the state money in early diagnosis, delays nursing home placement. And with that, Madam Chair, we do have some testifiers today.
Good morning.
Thank you. And before you proceed, can you please state your name for the record and then begin your testimony? Welcome to the committee.
Good morning. My name is Tuesday Glover.
Thank you.
I'm going to start my little speech here. So, good morning. My name is Tuesday Glover, and I work for Volunteers of America, Minnesota and Wisconsin. And I am the director of the Culturally Responsive Caregiver Support and Dementia Services Program. Volunteers of America of Minnesota and Wisconsin is a nonprofit health and human services organization committed to serving people in need, strengthening families, and building communities. For 125 years, Volunteers of America in Wisconsin has offered a comprehensive range of innovative services and networks that respond to and involve with needs of community in the pursuit of its mission to help people build hope, resilience, and well-being. I am here today representing the work and the services which I lead, the Culturally Responsive Caregiver Support and Dementia Services team. This service historically focused on supporting African American and East African community members through education relating to dementia, offering memory screens and supporting caregivers. The stress, health impacts, and costs associated with long journey of caring for someone impacted by dementia often creates 2 or more people who are in desperate need of support. Our work supporting caregivers reveals the importance of the impact of offering respite to caregivers. As she mentioned, dementia, a disease of the brain, is fatal. This vicious disease can affect memory, executive functioning, day-to-day living, and decision-making. Those impacted by the disease will eventually forget their loved ones' names, forget who they are, and forget to eat meals daily. They will need a caregiver. This caregiver journey can be stressful, and self-care is vital. Without proper self-care, statistics show that the caregiver will expire before the care receiver due to the demanding duties and stressors that come along with being a caregiver. As a speaker on behalf of caregivers, I'm sorry.